Hello, so this is Hannah Andrewson with, we're going to do BIOS 1300 lab testings. So I have my patient here. What's your name and date of birth?
My name is Addison and my date of birth is April 21st, 2013.
Alright, so we have a young one today, and we're in the upstairs extra bedroom clinic, and we are going to be doing some cranial nerve testing. So to start off, cranial nerve 1, that's your smell. So what we're going to do is I have this like perfume stuff. So go ahead, close your eyes and cover one nostril. Alright, and go ahead and smell. What do you smell?
Yes, it kind of smells like paint.
It's kind of like that. Okay, close your other hole and let that one go. Alright, smell.
Still paint.
Alright. And then next we have your second cranial nerve, which is your optic nerve. And for the first test, I have a makeshift chart for her to read off. So essentially you would stand 20 feet from the chart, cover one eye, try and read the furthest down line, and then same with the other eye, try and read the furthest down line, and then both of your eyes. So we're going to just do a little makeshift. So I'm going to hold it over here in the corner. Come over here. Read the furthest line down that you can go with covering one eye.
L-O-T-P-C.
Good, and that's the lowest line that I got. So try to cover your other eye.
L-O-T-P-C.
Alright, now both eyes undo. And can you read it any lower?
What? Undo?
Like, don't cover any eyes.
L-O-T-P-C.
Good job. Alright, so in a real reading, if she could read that low, she would have 20/20 vision. And, yeah, she doesn't have much difficult time with doing that at all. So the next optic nerve test, we're going to be testing her pupillary reflex. So I have to get our flashlight.
Just hold on 1 second. Okay, now she's back.
Okay, so we have a little light here, and I'm going to tell you, just look right at me, okay? Don't look at this. And ready? Alright, good. Now keep looking at me, don't look at the light. Good job. Nice. Perfect. So for this, you test one eye at a time. Just draw the light over, and you see when the light hits her eyes, the pupils will constrict. And the next test we have is our peripheral vision. So what I'm going to do is look at me and let me know when you can see my fingers wiggling, okay? Now, right here. Perfect. That's slightly over 90 degrees, which is normal. And so, yeah, that's cranial nerve 2. We're going to go to 3, 4, and 6. And I know Professor Klein always says 3, 4, and 6 makes your eyes do tricks. So what we're going to start off with is convergence. So that's when I'm going to hold my hand out here, and you're just going to watch my finger the whole time, okay? Watch it, watch it, watch it. Good job. So that'll make your eyes go in, and now we're going to do the 6 cardinal planes. So go ahead, look at my fingers, and watch this one, okay? Ready? Okay, now watch this one. Ready? Good job. Alright, so that one is pretty self-explanatory. Your eyes do tricks, so they look around, they can move, and do whatever. Next we have her sensory motor on her face. So we're going to take a little swab. Right here we just have a folded up Kleenex, and I want you to close your eyes and let me know when you could feel me touching your face with the tissue. Okay, ready?
No.
Alright.
Tickle.
This is a tickle. Alright, so yeah, you just want to take light touch. It's going to be able to, your cranial nerves for this one, number 5, does your light touch. And the motor function of this is your masseter muscle. So that's what you use to eat, and the muscle that helps contract your jaw. So go ahead, clench down in your teeth for me. Close your, keep your mouth closed. Relax. Clench. Clench, go. Bite down. Okay, let go. Bite down. Good job. So yeah, you just feel the little muscle contractions right over here. Alright, next we have our facial nerve for cranial nerve number 7. And for this, I just need you to do some silly little faces for me. So go ahead, smile. Big teeth smile. Frown. Go big eyes and go, ah. Oh, you're drawing good. Alright, now go move your lips weird. Open your eyes real big. Good. Alright, so those are working as expected. Now we have your...
I can make a funny face.
Okay, do it. That's silly. Okay, so now we have our cranial nerve 8, which is the whisper test. So what we're going to be doing for this is... Okay?
Yeah, when I touch my face with my tongue.
I'm going to whisper a few words in each ear.
How many?
3.
Okay.
And then she's just going to have to respond back with what I whispered. They're going to be different for each ear, so...
Curtain, bed, pillow?
Mm-hmm. Curtain, bed, pillow. Good job. And now for the other ear, we're going to do...
Dress, bag, chair?
Dress, bag, and chair. Next we have our, the reflex of your uvula. So what I'm going to have you do is, I'm going to pretend this here is our tongue depressor. I'm not going to actually put this in our mouth, but go ahead and open your mouth and say, ah. Good. And this one, you'll see the uvula depress in the back and move around from that motion. Next, we are going to do number 11. And that's your sternocleidomastoid muscles in your trapezia. So we're going to place our hands in certain areas and ask her to move around to see if her muscles can handle the force. So go ahead, raise your shoulders. Good, okay, move your head to the side, where my hand is, move it. Good, okay, the other side. Alright, push it back. Okay, now push it forward. Good job. Alright, so that's perfect.
My head's really strong.
Yeah, it's really strong.
And bouncy.
High five. And bouncy. Next we have, and lastly, which is our cranial nerve 12, our hypoglossal nerve, which is the tongue movement. So what I'm going to have you do is stick your tongue out. Put it up, down, side, side. Perfect. And those are our cranial nerves 1 through 12.